We're live. Okay, so presentation is on pediatric preventative screening. I'm Jenna and this is Cody. So we'll start with the AAP recommendations for developmental screening. So there's 3 aspects to this. So we start with surveillance. Now this is something we do at every single preventative visit. So it's not using an actual verified tool, it's just you're observing with your eyes. So the process of recognizing children who may be at risk for developmental delays through observation. Now, screening we will talk a lot about today, so that's kind of our big word. We will use a specific tool to screen general development of the child. So it is actually recommended to screen 3 times before the age of 3. So it's recommended at 9, 18, and 30 months, or whenever the parent or provider expresses a concern. In addition, we're going to do autism-specific screenings that are recommended at ages 18 and 24 months, and social emotional screening is recommended at regular intervals. So when there's a problem on screening or when you have a concern with the screener, say the kid fails the screener, you're going to move on to evaluation. So this is a more complex process aimed at identifying specific developmental disorders that are affecting a child. So there are 5 components to developmental surveillance. This is what we're doing at every preventative visit. So at first, we're going to elicit and attend to the parents' concerns about their child's development. We're going to document and maintain a developmental history. We'll make accurate observations of the child. We'll identify risk and protective factors. And environmental, genetic, biological, social, and demographic factors can increase a child's risk for delays in development. Multiple risk factors can amplify each other. Now, protective factors can be strong connections with a loving, supportive family, opportunities to interact with other children, and grow in independence in an environment with appropriate structure. So, does your surveillance that you're doing at these preventative visits demonstrate risk? If parents or the child health professional express concern about the child's development, a developmental screening tool to address the concern specifically should be conducted. So moving on to parental report. So this is very important. This is attending and eliciting to our parents' concerns. So you always want to open with a question that's pretty general. So what concerns do you have about your child's behavior, development, or learning abilities is a good one. So you want to follow with specific questions about the concern, if any. If a parent expresses concern about the child's development, a developmental screening tool to address the concern specifically should be conducted. This screening may require a separate visit, so if it does, schedule that as soon as possible. Parental concerns are generally valid indicators of developmental delay, especially language, fine motor abilities, or general functioning. So this is, I don't know if you can see it very well, but this is a good algorithm to move off of with our surveillance. So we start with our preventative visit. We're performing our surveillance. Now, does it demonstrate risk? Say it does. We'll administer a screening tool. Now, we'll talk a lot about these screening tools later, but say the results are positive or concerning. So we'll move on to make referrals. So whether that's a developmental or medical evaluation or early intervention. Then they will do their evaluations, which is the most complex, and then find out, is the developmental disorder identified? Say yes. Then you would identify the child as a child with special healthcare needs in your system so that you can manage them, follow them closely, and then you are complete. Starting at the top again, say you're at your preventative visit, you're performing your surveillance. There is no concerns on surveillance, but say it is an 18-month visit. You should still schedule your screening tool that you should administer at that visit. If the screening tool is not concerning, then you would just reschedule to the next routine visit and you're complete. Now, I'm going to spam you with a lot of pictures of my nieces. This
I thought these were you.
I look different. So there's 2. This is Zora. She lives in Portland. Now, we're going to kind of go through every visit. This is Jane. Sorry, I skipped a slide. So we're going to start every visit that we do in the outpatient facility. Obviously, they will be seen in the hospital, but we're going to start with our 3 to 5 day visit. So we will get our prenatal and birth history. We'll get our interval history since discharge, measurements, length, weight, head circumference, our weight for length. We'll verify the hearing screening results that were done in the hospital. Follow up with Billy as needed. We'll do our developmental surveillance, so the 5 different components that we discussed earlier. Psychosocial and behavioral assessment. So This assessment should be family-centered. It may include an assessment of child's social emotional health, caregiver depression, and social determinants of health. At each visit, age-appropriate physical examination is essential, with the infant totally unclothed or older children undressed and suitably draped. We're doing a great job with our anticipatory guidance handout. Now, by 1 month, this is obviously our 2-week appointment. So we're going to get our interval history, our measurements, same as last time. We're verifying those hearing screening results, doing our surveillance, our social behavioral assessment. Obviously, we don't see a lot of TB risk assessment, but it is recommended to do, or we don't see a lot of TB, but it is recommended to do a risk assessment for it. So one of the risk factors would be any symptoms or exposure to a family member with symptoms, including prolonged cough, coughing up blood, fever, night sweats, weight loss, or excessive fatigue. Birth or travel or residence in a country with elevated TB rate. So that would be all countries besides United States, Canada, Australia, New Zealand, and then Western and Northern Europe. Maternal depression screening. So this is something that we should be doing starting at 2 weeks and then going up until 6 months at every visit. I've used, we'll talk about it in the next slide, but physical exam and then anticipatory guidance. So the Edinburgh is a really easy maternal depression screener that I've used in the past. The parents fill it out themselves. It's a 10-item questionnaire. It's very fast. It can be administered in less than 5 minutes and scored in the same. Great. Good sensitivity and moderate specificity. You can. So at 2 months, this is Jane. Jane lives in Virginia. Now we're going to get our history, our measurements, again, hearing screen results. We'll be doing our surveillance that we're doing at every visit, our social and behavioral assessments. Again, we'll want to do another maternal depression screening, our physical exam, vaccines, and then our anticipatory guidance. Zora again. Interval history, measurements, our surveillance, our social behavioral assessment, our maternal depression screening, and then an anemia risk assessment. So infants who are born at term usually have sufficient iron stores until 4 to 6 months of age. Risk factors, however, for anemia would be prematurity. Babies get the majority of their iron stores from their mother during the last trimester of pregnancy. Additionally, babies born to mothers with poorly controlled diabetes or babies born at less than 3,000 grams. Iron-rich foods, we want to talk about initiating around 6 months. So those would include our green veggies, our red meats, and certain cereals. So 6 months and Jane is starting to get very chunky. We have our interval history. So we're going to see what's been going on since 4 months, our measurements. We'll do our surveillance, our social behavioral assessments. This is our last maternal depression screening. Our first lead risk assessment. So risk factors for lead obviously include lead-based paint. It was banned in the United States in 1978. So if they live in a home built before that, you're wanting to assess the risk. Lead contaminated house, dust, and soil, or a parent who works in construction, manufacturing, mining, or with guns. Now, oral health risk assessment. We're wanting to assess risk as soon as those teeth come in. So if primary water source is deficient in fluoride, consider oral fluoride supplementation. Optimal fluoride content is 0.7 parts fluoride per million parts water. Fluoride supplements can be prescribed for children ages 6 months to 16 years who are at high risk for tooth decay and whose drinking water has low fluoride concentration. Our physical exam, vaccines, and our guidance. Now 9 months, Jane is very chunky. We have our first developmental screening. So we're doing everything as before. So our history, our measurement, our social behavioral assessments, lead risk, physical exam, finishing out Hep B, oral health, and anticipatory guidance. Now, we're going to kind of branch off and talk a little bit about those developmental screening tests and some options that we have. Now, first, we'll go over the directly administered tools. So these are when the provider is directly administering them to the family. So we'll start with the TEL. It can be administered to 0 to 96 months. Takes about 10 to 15 minutes. Next, Bailey, we've got 3 to 24 months. Takes about 10 minutes. Again, Brigance 2, so 0 to 90 months, 10 to 15 minutes. Now the Denver, I think most people are pretty familiar with. It takes 10 to 20 minutes to administer. It is nice because it plots development on a growth chart, which is recommended by the Committee on Children with Disabilities to allow for comparisons over time. Now, parental questionnaires. So these are nice because the parents can fill them out in the waiting room ahead of time. So ages and stages is a pretty common one. So it has 4 to 60 months, takes about 10 to 15 minutes for the parent to complete. The CDI, or Child Development Inventory, is older kids, so 18 months to 6 years, takes a very long time at 30 to 50 minutes. My personal favorite, and born out of Vanderbilt, is the PEDS assessment. So it's the parent's evaluation of developmental status. Now, this has a wide age range, so you can start at 0 months and up to 8 years. It's a 10-item questionnaire, which you can see to the right. 2 to 10 minutes to complete. It's pretty quick. Now, this is nice because it not only has this response form, but it has a scoring tool and an interpretation tool. So it has risk categorization, which means it provides an algorithm to guide need for a referral, additional screening, or continued surveillance. 12 months, we're doing everything pretty much as recommended here. So we've got our lead and hemoglobin screenings, our vaccines, we're doing our TB risk assessment, looking pretty good. Same story with 15 months. We're doing everything as we should, so that's everything that would be recommended. 18 months. So 18 months is a big visit because it's actually a double screener visit. So the parents not only fill out a second developmental screening, but they're also doing their first MCHAT. Now, also the fluoride varnish we'll talk a little bit about later, but it's once teeth are present, really we can start doing a fluoride varnish either in our office or in the dental office, and it can be applied to all children every 3 to 6 months. Pretty quick and easy. And then we're doing our anticipatory guidance. 30-month visit. So this is something that's being considered to add. If we do not have a 30-month visit, then developmental screening can be performed at 24 months of age. So really that last developmental screening can be performed either at 24 or 30 months, depending on what visit we have or what our schedule is. Now, the 24-month visit, again, would be a double screener visit. So that would be MCHAT and a developmental screener. This is when we're going to do our last measurement for our head circumference. We're stopping length for weight and starting BMI. Obviously, our screeners, and then we'll do a dyslipidemia risk assessment for the first time. 3-year. Now, we are doing our blood pressure for the first time. It is recommended to do a vision screen at 3. Obviously, using the vision charts, it's tough at 3. I don't know if anyone's used spot vision before, but it's an instrument that you can, it's like a radar gun that you hold in front of the kid's face, and it gets a pretty accurate vision screening within a couple seconds. Now, developmental surveillance, our psychosocial behavioral assessment, we're assessing risk for TB, anemia, lead, and oral health, and then our anticipatory guidance. Oops. Now, I kind of start branching them together, so it won't take forever, but our 4 to 5 year, also known as our kinder visit. So we're doing our interval history, our height, weight, BMI, and blood pressure. A vision and a hearing screen is recommended, developmental surveillance, social behavioral assessment, physical exam, our risk assessment for TB, anemia, lead, dyslipidemia, oral health, and then our boosters for vaccines, along with our anticipatory guidance. So what you don't see here is hemoglobin and lead, which is not required, but obviously for kids with Head Start it is, so it makes sense to do that, but nothing requires a urinalysis. So at the kinders, we do not need to do a UA. 6, 7, and 8 year. So interval history, we're doing our height, weight, BMI, and blood pressure. A hearing and vision screen at 6 and 8 is recommended, and then our risk assessment at 7. Our surveillance, our social behavioral assessments, physical exam, same risk assessments, and then anticipatory guidance. So 9 and 10 year, We are doing our hearing and vision screening at 10, a risk assessment at 9, all of our normal surveillance and assessments. It is recommended to do a dyslipidemia screening. So instead of an assessment or risk or assessing for the risk, we're doing an actual screening. So it's recommended to screen for a lipid panel between 9 and 11, and then also between 17 and 21 years of age. So a lipid panel measures the total cholesterol, the LDL, the HDL, and the triglycerides. Now, our junior high visit. So 11 and 12-year-olds, we're doing our history, our measurements. We want to get a hearing screen between 11 and 14 years of age, a vision screen at 12, our developmental surveillance, our social behavioral assessment. This is when we start our tobacco, alcohol, or drug use assessment. A recommended screening tool is the CRAFT, which we'll talk a little bit about on the next slide. Our depression screening starting annually at 12. So every year from here on out, we're going to do that. Our physical exam, our dyslipidemia screening. So if that hasn't been completed between 9 and 11, we finish it now. Our risk assessments, and then our Menactra, Tdap, Gardasil, our anticipatory guidance. Okay, so we'll talk a little bit about mental health screening. So there's two that are pretty popular. Obviously, we're familiar with the first one. So patient health questionnaire, also known as the PHQ-9. It's a fast 9-item questionnaire screened specifically for depression. It's self-administered by the patient in less than 5 minutes. Scoring time for us is less than 3. It is very reliable. So with a cutoff score of 10 or more, our sensitivity for major depressive disorder is 88%. So it's pretty reliable. Our PSC-17 or Pediatric Symptom Checklist, a little bit longer at 17 items. 4 to 16 years of age, it can be administered. If you're over 11, you can do it yourself. It's pretty broad, so general psychosocial screening and functional assessment in the domains of attention, externalizing, and internalizing symptoms. Less than 5 minutes to administer and scored in 2. So this is the CRAFT. So this can either be printed out and the kid can answer yes or no, or you can verbatim repeat these questions to the kid in the visit. So CRAFT is a mnemonic acronym of first letters, keywords, and the 6 screening questions. So C, have you ever ridden in a car driven by someone, including yourself, who is high or had been using alcohol or drugs? Do you ever use alcohol or drugs to relax, feel better about yourself, or fit in? Do you ever use alcohol or drugs while you were by yourself? Do you ever forget things that you did while you were using alcohol or drugs? Or do you or your family or friends ever tell you that you should cut down on your drinking or drug use? And have you gotten into trouble while you were using alcohol or drugs? 13, 14, and 15. So more of the same. So we're doing our history measurements. We're going to do a vision screen at 15, a hearing screen between 11 and 14, and then again between 15 and 17. Our surveillance, psychosocial, and behavioral assessments. Again, we'll do our tobacco, alcohol, and drug use assessment, depression screening every year, physical exam, our risk assessments, find out if they've had Gardasil and complete that, and then anticipatory guidance. So last but not least is our 16 to 21-year-old older adolescent group. So we have our history measurements, our last audiometry, so 15 to 17, and then finally between 18 and 21, our developmental surveillance, social behavioral assessment, our tobacco, alcohol, and drug, our depression screening, our dyslipidemia screening. So you want to repeat this, so 9 to 11, and then again at 17 to 21 years of age. Our risk assessments, Gardasil and then B, and then anticipatory guidance. So these are kind of the summary of recommendations for WeCare specifically. So 5 components of surveillance at every preventative visit. I believe most people are doing that. Our maternal depression screening, such as the Edinburgh screening at 2 weeks until 6 months of age. Our vision screening starting at 3 years, possibly with an instrument. Our administer standardized developmental screenings at 9, 18, and 24 or 30 months. Know your analysis at kinder. Depression screening in adolescents starting annually at 12. Dyslipidemia screening between 9 and 11, and then once between 17 and 21. And our audiometry screening including the high frequencies, between 11 and 14, between 15 and 17, and then between 18 and 21. These are a list of great resources if you need anything or if you have questions. And thank you. from Ryman. Dog. And we'll take questions for anyone. Right. There's different billing codes, whether like you administer it yourself or they fill it out themselves. But obviously, yeah, we would definitely not have all of the time in the world.
Then we're working on getting things on the board.
Mm-hmm.
For somebody who's out. Is that something that we could and can do with our new system? So in my experience, I'm not experienced, not much. So, and we can mention it's pretty quick. Yeah. The PEDS form.
Yeah, the PEDS form. Yeah, PEDS response form. Oh, that's fine. Kind of mix it all together.
Yeah, I was gonna ask, is the PEDS one you were talking about, is that one free?
Mm-mm.
Yeah. It just takes so long.
It
It's
does.
pretty, by the end, the parents are so tired of filling out, it's not accurate. If they did it ahead of time, like on the portal, it might be useful. And if we only did it 3 times instead of, we used to do that every single visit, and they'd just be so tired of filling out paper.
Oh yeah, for sure.
They're so quick.
Yeah, it's a 10-item questionnaire, but yeah.
And PHQ 9's fast.
But Edinburgh is administered 2 weeks to 6 months, so that wouldn't overlap with MCHAT at all.
Just curious how many of you are doing maternal already? Yeah. We're trying to do.
Yeah.
So I
Yeah,
have
not doing a screener.
I have a list of websites that they hand out, and then somebody, I can't remember which, some local public health department or something sent out some pamphlets that had to do with depression as well. But I tell me talk to the but usually, I mean, in South Carolina, you want to see their repeats like 6 weeks postpartum. Yeah. So a lot can happen in 6 weeks. So you just say, hey, you should call them and talk to them. It's more just an awareness of one of those. Hey, one of those. Yeah, we've been waiting until 2 months to do it, so I think Mark might be probably more helpful.
Yeah, the old clinic we just did it once.
As you say, at 2 weeks, I'm like, I think every parent's gonna lack of say.
Yeah.
I just have a list, again, just a list of websites that useful information for them.
With the new ELR, there is a way, I don't know what you can email through the portal to PHQ 9, or you can print it out with their right from their chart, and then you scan it, and there's a barcode you can scan the chart for you. It's still at it. That will make it easier, I think, than have that tool right at our fingertips.
And I don't know who we talked to as far as it's yeah, Jeff is actually going to, as you mentioned, this 40, 90, 45, talking about some of this stuff. So we did decide the option of doing the third step. We're going to look at and we are looking at buying
Vision.
Yeah, vision. And yeah. So yeah, perspective. On that as well.
Mhm.
Yeah. So our clinic just rolled out a prevention thing like 2 months before I graduated, and they had like a device that used the camera feature to screen for this program. It was just like any type of thing that they used primarily for that. And it was pretty seamless transition. So
There's a few different ones available. The Walsh Allen is closer to 7,000. There's the one that just uses the phone app, and that is, I think if you pay in advance or pay for a whole year, it's like $90 a month or something. And I think you get reimbursed about $7.50 to $10 per screen.
My son was caught on one of those, so
yeah,
I'm all for it.
yeah, it's impressive how good the technology is to pick it up early, like you said, for 3 to 4 years.
Yeah, also you just get a lipid screening in our office. Yeah. So, yeah. Because we should, because I get it done more often. We could do it in the office.
Yeah, I'd say probably 80% of patients figure out things back. Another one, I'm not your parent, but they don't know. Message will be like, oh, he's fine.
The last 2 I scanned, I'm still waiting 2 weeks. And I'm back. So I guess I knew it both were East, but they weren't. Yeah, like, yeah.
Do we know how insurances work with the lipid screening? Because a lot of the times the parents ask me, is it covered? And I'm like, I don't know. You have to talk to your insurance.
It's a recommended screening. You would think that it would be covered under. But a lot of families have been doing for pretty consistently. What we call the one that so, I mean, a small number there. It's pretty well covered for most plans. What about the audiometry screening?
Yeah, that's a new one.
Like, because I know in emergency we had just like the little one that just beeps and you raise your hand or whatever, but it's always noisy and like.
When we did it in school,
Yeah.
I don't know how consistent it is, but I give it to but it's not very comfortable.
that surprised me. It was like 3 times now.
11 to 14, 15 to 17, and 18 to 21.
Right now, I think we'd end up having to send them to audiometry.
Yeah.
Yeah.
So is it more a matter of just kind of picking our battles and saying what's going to be the cheapest, what's going to have the highest reimbursement? I mean, because there's a lot of things here, but
Yeah. All those things.
or do we just kind of individually say we're going to put this up?
Well, it'd be nice to
We'll
get.
probably do across the board.
Yeah, we just need a plan.
You get $6 for PhD line.
That's what I'm saying.
Yeah. I have had one.
Have you?
Yeah. One called me Jennifer got denied.
I got a bill.
You need some bucks for your
How many?
So why is that not covered under your? So I one weird piece.
What about like, I've never heard of anything.
I've had a few parents decline to fill it out. Yeah.
On some of those websites, they include like posted the other day and showing like which ones are free. I think it's free.
Yeah.
Free.
Oh, on the
As
assessments.
far
Yeah,
as to use
yeah,
it
yeah,
as
yeah.
free.
Absolutely. It did. One of the websites, the mental health website, says, yeah, the third one down. Gives all the tools.
What is the screen you guys use? For Melville? Yeah.
Swig and you tell us something different.
Incorporated. Because we were using something and they started charging more and they wanted
I mean, even if we just did it at like the developmental 9, 18, 30 months.
well, they had one at every 2 fourths. We built it.
I don't know, I guess if we found something simple and replace, because I always spend at least a couple of minutes going over developmental milestones. If we just replace that with screening, which would be my first for it, something to do. But I think it's a lot of myself. Practice wise, it's relatively. Yeah, I mean, this book, I liked it mostly, but there's some stuff on there that I wouldn't normally care about, but.
I mean, you know, there's actually in there, and it's like smoking exposure and like.
I think I'm the 2 month that asks, like, does your baby cry a lot? And like a few questions like that.
What am I gonna do with this information?
Discussion.
You asked the question.
Any other questions or comments? Before I heard, when we started doing it, we see. Yeah, Lauren and Jeff Jones is looking into that. What is that?
It's just, yeah, it's like a brush. It's not a leader.
Yeah, but even with that, like, so, you didn't have to do their molars, they just said that just
Yeah, it's actually a seal that goes on the tooth versus just a fluoride.
And you don't have to be, I talked to the dentist, you don't have to be super, like, you don't have to like paint each tooth, it's pretty much, you just get a swab on the bottom, a swab on the top. And
We did it in
that's enough.
residency, and that's single use, so in your pillow.
Like,
Just swipe it on the front and the back.
That's what they do with the dentist, right?
Yep.
But you can have it to 4 times a year, so.
You're like, yeah, right.
Trash in there.
But it works whenever. Replacing the dentist. Yeah, and that and the vision test. They're definitely looking at costs. I'll look into what they use. Yeah, I'd like to get with yeah. Maybe just touch base.
It's a medical device.
Does the FANA have the developmental plans in age group? Yeah.
And boy, something that can use an app, and all these kids are looking at smartphones when we're walking into the room anyway. It seems like that's almost tailor-made for the average kid. Yeah, yeah. I mean, they would just.
Okay, well, thank you, everyone. If you have more questions, email me. All right.
Thanks.
Thanks.